Today, we have the opportunity to hear from Heidi Ortiz, who is the ATOP Prevention Program Coordinator that works in the Student Health Services Department. Without going into too much detail, I'll pass the mic on over to Heidi. So, Heidi, the floor is yours.
Thank you so much, Marvin. And good afternoon. Welcome, parents. I'm Heidi Ortiz. I am one of the health educators that works at Student Health Services, specifically in the Office of Wellness and Health Promotion. And in my role, I also coordinate the alcohol, tobacco, and other drug program. So I do want to welcome you all and happy to share with you some tidbits about our clinic or the services that we have available to your students. Perhaps one of those resources that oftentimes gets missed because of so much information that's being given to your students at this time, as you can imagine. And having you all here, I can tell you all that as their parents, you are one of their strongest supporters, one of their biggest advocates to encourage them to really take charge of their health and seek out the resources that are available to them here at this university. So I will be sharing some information about our clinic, and at the end, there'll be a little bit of time for myself and one of the other health center staff to help answer any questions that you might have. So about Student Health Services, or SHS as we like to call it, we are a nationally accredited ambulatory care facility with licensed medical personnel, and we're conveniently located on campus. So pretty much the services that we do offer are primary care services. Everything that you see listed on the screen is what students can certainly tap into. Specialty care that includes sports medicine, psychiatry, gender affirming care, reproductive health. We have our own laboratory on site, pharmacy, which is very convenient too. I often like to tell students that this is a neat offering that they have available as long as they're a student. Lots of the stuff that we've got at the pharmacy, it's relatively low cost and easy for them to obtain. They don't need an appointment for any of that, but I'll go into a little bit more detail as we go along. We also have the capability of offering X-ray, health education, case management, immunizations, family packed enrollment and services, and we offer a ton of resources around mind, body, and wellness. Perhaps one of the biggest questions that comes up related to student health services is the costs. Lots of parents wonder, is it free? What if my student is already covered under my own health insurance plan? All great questions, excellent questions, and it is one of the most frequent ones. There is a $75 student health fee that is already included with your student's tuition. So beyond that, they never have to pay to come and visit our clinic. Now, there are some possible extra costs for students, things like medications or over-the-counter items that they may want to pick up at the pharmacy, some immunizations or some lab tests if it's something that is not covered. The clinic does not require or bill health insurance, so we do not need it. All students are welcome. Now, the student health fee shouldn't be looked at as a form of health insurance. I certainly do tell students and their parents that if you have a plan, to keep your plan. Please do not, cancel your plan or take them off because this is not meant to replace that. We do offer lots of wonderful services, but at the same time, there are lots of things that we don't provide, but we can certainly help them navigate those services off campus. So if they do have a plan, we can definitely help them navigate that a little bit better, because as health insurance plans and all that good stuff, it can be a little daunting at first to kind of understand. So we're here to help. Our hours, we're open all year, Monday through Friday, and it's very easy to make appointments. Students can call to schedule those appointments. The main student health services line, walk-ins are welcome as well. What happens when students get sick during the weekend and during evening hours? Well, we do have an after hours nurse advice line that's available for nights, weekends, and holidays. And so this is a really nice service because, of course, that tends to happen quite a bit. So we want to make sure that the students feel supported and know that they can, trust that they'll be able to speak to an individual that will guide them through whatever it is that they might be experiencing. Now, Student Health Services is located on the corner of Beach Drive and Merriam Way across from parking lot G1, housing and the nursing department. So for any of you parents, if you've had the opportunity to come on campus already to tour the campus, which is beautiful, we're a little bit off to the side, but I mean, it's a huge campus. So I always tell students, make sure you know exactly, where the clinic is. If they're taking, if they have a long day of classes one day and perhaps they just, happen to feel ill, they're not doing so well. Maybe there's like a minor, injury that they want to get checked out at the clinic. Knowing exactly where that is will help alleviate some of that stress and frustration, not knowing where to go. But anyways, you can see on the map there, it's very convenient to get to, and we're here to be of service. Now, one of the most common questions too, in order to, for the onboarding process for your students is with regards to immunizations. So by now, most of your students should have already uploaded proof of the following vaccines. Now, there are some special or some unique circumstances, based on some of the questions that have come up in the past too. For whatever reason, maybe there's just something that's beyond your control that you haven't been able to upload something. And there's been a little bit of like that concern, we've already passed the deadline, like, is that still okay? As soon as you have, proof for certain vaccines, we always recommend to just, upload that as soon as possible. Even if something is still outstanding, just go ahead and upload that. In addition to what you see there, if your student is going to be living in housing, they will need to submit proof of meningitis B vaccine that they've had, that they have this vaccine. Like I said, we will be answering some questions with regards to this, and I'll go into a little bit more detail on how you can upload this proof. Now, with regards to those immunizations, the only thing that we do except in terms of exemptions, medical exemptions are allowed for all the immunizations except COVID-19. Medical and religious exemptions are being allowed for COVID-19. Now, for any questions with regards to immunizations, like I shared on the previous slide, COVID-19, all that, you can certainly go to our website for a little bit more detailed explanation of that. Even after you've navigated the website a bit, if you still aren't quite finding what you're looking for, you can always give us a call and we'll be happy to help you. Now, as I mentioned earlier, making appointments is very, very easy. You can always call to schedule appointments in addition to walking in. Students may also go through their patient portal just by clicking on the Student Health Services app on their single sign-on page. And what they will need to do is complete necessary forms prior to their first visit. Now, there are occasions where students sometimes don't get to that until they've walked in, and that's okay. We will be guiding them on the forms that they need to complete. But one of the biggest things that I like to talk to parents about is, or share, is that as you're preparing for your student to enter their first year or, to start college, one of the best pieces of advice is, how to prepare them for those medical visits. All these years, I'm sure many of you have helped them, navigate their health, their insurance, doctor's appointments, et cetera, et cetera. This is a perfect opportunity to talk to them about, their allergies, any medications that they might be on, or might be taking, all of their prescribing details and their overall health history, making sure that they really truly understand that, because that having this information will certainly help for them to have a pleasant experience, or an awesome first visit with one of our providers here at the clinic. Confidentiality is of the utmost importance. So we do respect our students' right to confidentiality and privacy. So for any students 18 and older, health information is never given to any parents or guardians. Students that are under the age of 18, there is a need consent. Uh, we do need to have a consent for treatment form signed, which can be obtained on our website. And health insurance. Again, I've made a few comments about this already, but student health fee is not health insurance. Okay, so we do not require it. We don't bill it, but it's also not to be mistaken for an actual health insurance. Okay, personal health insurance is recommended for after hours care and specialty care. So things like emergencies, or perhaps your student. This has come up a bit in the past. Is like, I find that I think I might need some glasses, or dental care. Those are services that we do not provide here. So they can still certainly bring it up during an appointment if that's something that they want to look into a little bit further. And we've got excellent staff that can help them kind of look into their insurance provider, and just kind of help them get a little bit more comfortable with finding a provider out in the community for that. Also, oh, so sorry. um, I, I paused there. If they are under your insurance card, your insurance plan, make sure that they have a copy of the insurance card, just in case for emergencies. And then, like I mentioned, if they do need help getting insurance, some students will like, well, I don't even have any of that. Where do I start? I don't even know how to go about that whole process. They can certainly get in contact with our office. We've got staff that can help them, you know, uh, look into that a little bit further if they are interested in getting some insurance for themselves. All right, so with regards to health education, one of the biggest things that we focus on in the area that I work in is with regards to wellness. And wellness certainly doesn't just focus on being free from illness or disease or any of that, but it's a lot of things, right? Their nutrition, how they feel with stress, because that is certainly something very, very prevalent with our college population. There's so many changes that they're having to deal with, and a new environment. So we certainly want to be here to support that. We offer a variety of individual sessions related to nutrition counseling, sexual health, birth control. We provide, information around STI, HIV diagnosis, substance use and abuse, education, pregnancy options, counseling, smoking and vaping cessation. And we also offer workshops and classes on many of these topics that you see on the screen here. So meditation, mindfulness, yoga for healing, stress less. Again, all things with the intention of supporting our students throughout the academic year, particularly during the times of the year or semester where they might be feeling a little bit more on edge, midterms, finals, those types of things. And all this that you see here is free. And our contact information is on the screen. It's very easy to get a hold of us. After the questions that you might have for today, if you still feel like you have some questions that didn't get answered, or we log off and something pops into your mind, please feel free to email us at wellness@csob.edu, or you can call the clinic at 562-985-4771. Another thing too that I like to share with folks, especially students, is that if they are on any social media platforms, Facebook, Instagram, Twitter, and YouTube, we do have our social media handle there on the screen. We're always posting health information about our events, wellness tips. So I encourage you all to follow us on our social media platforms. And that's pretty much it. So I just want to say thank you for giving me this opportunity to speak to you all, and welcome to the beach.
Fantastic. Thank you, Heidi. Alrighty, folks. So now is your time to ask questions. As a friendly reminder, for everyone that's watching us on Zoom webinar, you'll be able to ask your questions in the Q&A button. And then for folks who are watching us out in Facebook world, you'll be able to ask your questions by putting them in the comment section. And then from there, our team will be able to ask them to us. Alright, so we have a few questions already in the chat in the Q&A button, Q&A portal. Let's see. I think it's already answered, but the question is, will the family plan be primary or the student health be the primary one?
Okay, so so if the student is already on your plan, your health insurance plan, you keep it. That is for you. Some students prefer to just go through all of their primary health care needs through their insurance, that type of thing. But take advantage of the services that are here at Student Health Center. This is something that's convenient for the student, especially if, say, for example, their primary care physician is down in South County, in Orange County, or just a couple of hours away, where it's maybe not that easy and not that convenient to get a hold of them, or to have an appointment right away. If it's something that's a little bit more basic, they can certainly use the services here at SHS almost immediately, Monday through Friday.
Thank you, Heidi. All right, let's see. The question is, what are the major items that could be potentially excluded under this coverage, or is it for just minor, unavoidable, quickly treatable conditions to avoid class interruption?
I'm sorry, could you repeat
Yeah,
that?
of course. I'll break them into two
Sure,
sections.
sure.
Let's see. What are the major items that could potentially exclude under this coverage, or is it for just minor, unavoidable, quickly treatable conditions to avoid class interruption?
Yes, they're gonna, you know what, that's pretty much up to the discretion of the provider here at the clinic. Whenever the student's in doubt, I would always just say, just come in and get seen. If there is a situation where perhaps the attention that the student requires is beyond the capacity of the clinic, we're gonna do what we can to get them to a place where they can receive that care.
Fantastic. Let's see. Would it be helpful if I sent my student down with the medical record so that they could put it on file in your office?
Oh, what do you think?
Well, it's much easier if they upload them through the patient portal. There's directions on our website, and it's how to upload them, and it shows them step by step. It's much easier that way. They can always call us after they do that. They can even ask for me, and I'll be more than happy to help them and go and review their immunization records with them. And we can go from there. But if they can't, I mean, they can definitely bring it, but we encourage them to upload it to their patient portal.
Great. Thank you, Raul. Let's see. We have a few more questions on Facebook. My student is under a variety of prescriptions. Is there a staff member on staff available in the event that they have to see if there's going to be any reaction to their medications, like Tylenol or anything that you'll have to offer?
Yes, absolutely. We've got staff that works closely with that. And so, again, that'll be a conversation for the clinician that's tending to them. And we do have a pharmacist on staff that will also talk to the student as well about any sort of conditions that might be dealing with, and go over the prescriptions and all that. But if you still have questions in regards to that, I would encourage you to have your student reach out to the pharmacy with those particular questions, just so they feel a little bit more comfortable in what they can expect.
Fantastic. Let's see. Do you have any physicians on site, or is SHS just NPs?
No, we do. We do have physicians on site in addition to NPs. I believe if you go to our website, you can see a list of the staff, the specific staff that we've got available. And Raul, if you wanted to add anything.
Yeah, I mean, we have awesome doctors, awesome providers. Anywhere from primary care to sports medicine, And, we're more than happy to help you. But yeah, there's, you can view our staff. You'll be able to see our doctors and the whole Student Health Center staff online. So
Great, thank you for that. Let's see. If my student requests for me to go into the meeting with them, would I be allowed to go in with them?
Unfortunately, that is not something that we would be able to allow, but again, you know, if I would encourage your student to have or bring that up during the moment that they want to book an appointment, they want to schedule an appointment, because this question does come up frequently. So again, just going back to one of the things that I said is, and just, having a conversation with your student about their health history so they themselves feel comfortable advocating for themselves, and being a little bit more independent, and just if there are some concerns there that you feel like perhaps didn't get asked, and I would encourage you to have a conversation with your student to make sure that those things are getting addressed.
Awesome, thank you, Heidi. What kind of coverage is available for international students, or is it the same for all students?
Great question. There is, I believe, on our website, Student Health Services, you will be able to see the type of insurance coverage that is available for international students. They do have access to the clinic itself, but I believe there's a certain requirements, things where the $75 student health fee isn't something that's immediately included in the tuition, but rather they have to pay a copay of $15 until they reach that $75, and then they can continue to come in as often as they need to at no cost. But there is a little bit more detailed explanation on our website on what you can expect, or what students can expect if they are here through international studies and whatnot.
Awesome. Let's see. If my student lives in Long Beach, would they be able to access your resources over the summer or even during the holidays?
Absolutely. So we are open during the summer, with the exception of just some of the major holidays, where we do close. But you can see on our website, it's Monday through Friday. But whenever spring break comes around and students are off campus, we're still fully operational.
Awesome, thank you. Let's see. Uh, are students able to access your resources after they graduate? If so, how long after they graduate do they have the availability to use it?
Oh gosh, that's a great question. I believe, yeah, I would have to double check on that. Yeah, I can't remember. But that has come up a bit. I want to say I don't even want to guess. I'm not even going to try to guess and give misinformation.
as far as I know, I believe it's a month after
Okay.
they can use some services. But yeah, the best thing to do is call the health center, and they can check with the receptionist, and they can let them know.
Thank you.
Thank you, Raul. Let's see. Does the SHS take care of routine flu vaccines or any public health emergency mandated ones?
Yes, if your student is missing a vaccine, they can always come here to the health center, and we have vaccines here to provide with whatever they're missing.
Great, thank you. Let's see. This coverage is only valid per semester, correct? If not enrolled for summer, is there no coverage?
So the coverage, yes, it's per semester, and for summer, if they are taking classes in the summer, that's included. But so like right now, I know one of the questions that's come up is like, okay, my son or my student is starting in the fall. Can they start utilizing the services in the summer? And they would need to wait until classes fully start to utilize those services.
Awesome. Let's see. As a reminder, folks, you'll be able to ask questions in the Q&A bubble. And then for folks watching on Facebook, keep submitting your questions in the comments. All right, let's see. What kind of resources are available for students that have physical disabilities on campus?
So once they come in, if they were to come into student health services, and if they needed some accommodation for a class, or they need to miss because of something that they're getting treated for here at the clinic, we have providers that will be working with them to get those accommodations that they need. In addition, we have a department on campus that can certainly work with them on that on a more of a long term if they require it while they're on campus.
Great, thank you. Let's see. Does your office hire students during their first year?
We do have opportunities for students to work, particularly in the area of Office of Wellness, in the area where I'm at. As a matter of fact, we did just go through a recruitment phase over the summer for students that are interested in working part-time and doing a little bit more around health education. So those are the types of opportunities that we have available to students. One of the best ways to get involved, if after they looked at that and they feel like, oh gosh, I'm so busy, I want to be involved to some extent, because health education, student health and wellness is very important to me. I would say to just get in touch with us and look out for those opportunities. We oftentimes post on our social media platforms, and there's volunteer opportunities too. And so I would say to just keep a lookout, but yes, we do definitely provide or offer that as an opportunity for students who are interested.
Thank you, Heidi. All right, folks, and it looks like this will be our last question for the day. Let's see. If students develop severe illnesses, is there an ability to accommodate for 2 to 3 days? Would they be monitored if they're in the dorms versus if they're off campus?
That's a great question. I think that would be a question that perhaps one of the clinicians would probably be better equipped to answer, but I can assure you that we do work very closely with housing when there is a situation at hand that perhaps is getting in the way, and if the student is in housing, there is excellent communication between both departments to make sure that that student is well attended to.
Yeah, and if I can just add, if a student does have a severe reason to come to the health center and needs to see a clinician for 2 or 3 days, if the student is able to go back to their dorm and then come back the following day, of course, we've done that before. So the student would just come the following day and get treated by the doctor. So
Fantastic. Alrighty, folks. And with that being said, that was our last question for the day. But with that being said, in the event that you run into a question that you want to know the answer to and don't know where to start with our PFO office here at Parent Family Orientation. On the screen, you see our contact number and our email. So in the event that you have a question and you don't know where to start with our office. We'll be able to help find the answer for you, as well as help accommodate anything that we help accommodate all your questions and make sure that you have them answered. Fantastic. And that being said, folks, well, on the screen now, you see the opportunity for all of you to enter our opportunity drawing. Go ahead and use your phones to scan the QR code. And then from there, you'll be able to actually let us know how we can improve these programs and let us know what we can do to make them better. Along with that, we're dropping the link in the chat. So you can go ahead and click on that link and then take a short 5 minutes to fill it out and let us know how we improve. Now, before I head out, I just want to say thank you to both Heidi and Rule and for spending this past hour with us and helping answer all your questions and for sharing with you information that will be successful for your students. And with that being said, I did want to give Heidi and Rule the opportunity to share any last minute thoughts, share any advice with their parents and families before we head out, and just we'll go from there. So we'll start with Heidi and then we'll go through Rule.
Sure. No, I just want to thank you all for listening to a little bit more information about the clinic. As a parent, I'm sure can be a very nerve-wracking time as you send off your student to experience life here at the beach. And I can assure you that we're here to help. We're very student-centered. Many of us have been working on this campus for many years, and we definitely love the interactions that we have with our students. you know, we've got children ourselves, so at the heart, the root of everything that we do, it's always about the student and making sure that their needs are always met. So we're here to help. We are here to help. Please encourage your students to check out the services here at the clinic. Yeah, I look forward to seeing a lot of them.
Well, thank you for having me. I hope everyone has a great weekend. Best wishes to all your students. We're here, you know, Monday through Friday to 5 to help your students with whatever, you know, might be bothering them. So our mission is to make them healthy again, so they can have a great semester. They can concentrate in school. We have an amazing team here. So, you know, we're here to help with whatever we can.
Thank you both once again. And folks, Heidi and Raul have been amazing this entire summer. They've been spending countless hours with us, helping you all out, and they've been working really hard to make sure that your students are feeling comfortable and prepared for the semester. So I just want to say thank you to both, to you, Heidi, Raul, and to your entire team for everything that you've all done.
Thank you.
And with that being said, folks, we just want to say thank you again for joining us for this past hour and taking the time to learn more about what our university has to offer your students. We know that going to college and going to university can be a very petrifying feeling, but we hope that with this information, you're able to feel a little more comfortable knowing that we have people here that care about your students, about their well-being, and want to see them succeed. But above anything else, we hope we get to see you students here in the fall semester. We hope you all have a great weekend, that you all take care of yourselves, stay healthy. And that being said, have a wonderful rest of your day. Take care of yourselves and go beach.